Children's Minnesota was one of my top choices when I was applying for Pediatric Emergency Medicine Fellowship, and I'm so glad that I matched here.
The Children's Minnesota Pediatric Emergency Medicine Fellowship is over 25 years old. It actually started as two separate programs in Minneapolis and St. Paul, but it combined a number of years ago.
Here in Minneapolis, we see more of our cardiac patients. In St. Paul, more of the neurology patients. But across the spectrum, the exposure and the experience for a Peds Emergency Medicine Fellow is second to none, really.
Each shift is around 8 hours long. Usually we see anywhere between 8 to 13, 14 patients a shift, doing procedures like incision and drainage, or if a trauma comes, trying to lead the trauma, doing your primary, secondary surveys.
We also have a robust education program, so we have 4 educational days per month where fellows get to do everything from teaching emergency medicine residents, presenting on different topics, and they get to do simulation and ultrasound training.
We have a large variety of attendings who are so approachable. You can ask them any question. And my co-fellows, we are a group of 9 right now. We come from different backgrounds and cultures, so we learn a lot from each other as well.
Overall, I think it provides as rich and deep and fulfilling educational experience for a fellow as anywhere else in the country.
We have 2 large trauma bays. We also have a separate space where we can do sedations, and many of our rooms actually have nitrous oxide, so we can do more minor procedures directly in the room, and that's something not a lot of places have.
While you can see 90 to 95,000 patients in one department, as many do, we see that spread over 2 departments that are well-staffed, well-equipped, share the same EMR. It allows the fellows a little bit more face-to-face time with the attendings. They learn to know the nursing and ancillary staff a little bit better. And I think overall it helps to enrich and improve the educational experience.
I think the best thing about the fellowship program here at Children's Minnesota is the people. We have a really heavily involved and interested core faculty. We have great support from the department, and frankly, our fellows are awesome.
What I love about Children's Minnesota is that I get to grow every day as a physician. I get to interact with a lot of different kinds of people coming from different cultures, from different backgrounds, from different states. And I feel like even if I practice in a smaller community hospital or go to a level 1 trauma center in a different state altogether, I will be able to give the appropriate care and manage my patients appropriately.